COVID-19, Dr. Lauren Streicher is back with us. Dr. Streicher, what is your thought about the timeline on this?
Well, pretty much what the experts are saying. The expectation is that things are going to continue to get more active in the next week or two. And as best as we can tell, peaking in Chicago in about 2 weeks.
All right, let's get to some viewer questions. Is it true that drinking warm water every 15 minutes will decrease the chance of getting sick?
Have you seen this one? This one's all over the internet.
Right.
And so this is the premise. We know that heat kills the virus. That's true. So the idea of this is if you keep drinking warm water, then if there's any virus in your throat, it'll kill it before it gets to your lungs. This is not true. This is crazy. This is one of the many scams that are out there. The only thing I can say about this particular scam is at least it's not dangerous and you're not spending a lot of money on it, unlike a lot of these other scams. But if this was really the case, don't you think that Dr. Fauci would be all over the news every single night saying everyone drink hot water every 15 minutes?
Very true. All
no,
right.
Not on this one.
Here's another one. A friend was having symptoms and had a COVID test, which was negative. He then went on to get really sick and was hospitalized. His second test was positive. How could that be?
Well, the COVID test is not 100% sensitive, meaning that we are going to get some false negatives. Right now, depending on the tests that you get, you're going to get between a 60 and 80% sensitivity. So that means, yes, there are people that will be tested and they're told that they have a negative test, which of course is very reassuring, and then they go on to get more symptomatic and they need to repeat the test. So I think tests will be improving as time goes on, but the message here is even if you have a negative test, if you continue to feel sicker, please call your doctor back.
All right, next question. Do pregnant women get sicker if infected with COVID-19 than non-pregnant women?
So far, this is good news. This is reassuring. We know that a lot of women who are pregnant are also going to be infected and get COVID-19. But it doesn't appear at this time that pregnant women get any sicker than non-pregnant women, other than there might be a little bit more chance of preterm labor, but the data is a little bit shaky. So right now, seems to be okay.
All right, this person says my OB has reduced the number of prenatal visits. Is that a problem?
It is not a problem. Interestingly, over the last couple of years, there have been a number of studies looking at the number of prenatal visits to see if the standard 12 to 14 visits are really necessary to get optimal health for mom and baby. And it turns out that in a low-risk population, you can basically cut those visits in half as long as you're doing virtual visits in between. And the reason this is doable is because of the ability to do some remote monitoring. Women can weigh themselves at home. They can have blood pressure cuffs at home. A lot of doctors are even supplying these home Doppler units. Now, you still have to go to the hospital or to see your doctor, of course, if you need an ultrasound or blood work. But it turns out that it is safe as long as you're low risk and as long as you stay in touch with your doctor if you have any concerns. And this, of course, turns out to be a really good thing for pregnant women because we want to decrease their exposure and we also want to decrease the burden on our healthcare workers.
And what about breastfeeding is another question.
So far, it appears that even if a woman has the virus, that it does not show up in breast milk. The problem is if a woman is sick and if she's breastfeeding her baby, she's going to breathe on the baby. So the recommendation right now by the American College of OBGYN is that a woman who is breastfeeding who has the COVID virus can continue to breastfeed her baby as long as she's wearing a mask, obviously washing her hands, washing her skin, not touching her face, all of that. And for women who are really concerned, they just don't want to take any chance at all, they always have the option of pumping and having someone who doesn't have the virus feed their baby.
All right, Dr. Streicher, thanks for being with us.
Thank you.